Hi, I'm Dr. Rebecca Bernard, and thank you for joining me for a discussion of stress management for women medical students, strategies for a successful career in medicine. I've included my contact information here for any questions about the content. When we talk about stress, it's important to recognize that not all stress is bad stress. Stress is simply the body's response to a stimuli, and if we don't have any stimulation, then of course we're going to get very bored and not have any ambition. So as we face a little adversity or a little stress, it helps to get us motivated, it helps to get us focused, and those stress hormones can actually help us to give our peak performance. And this was described by the Yerkes-Dodson law that shows that as stress level increases, we get to a peak, and then the stress can then go into something called distress. When it's no longer a positive, it now becomes a negative because the stress is overwhelming. And that's when we start to get fatigued or exhausted. So stress is only a problem when it gets to the level of a negative, and that's called distress. We know that medical students do experience more distress than their peers that are not in medical school, and that includes anxiety and depression. And it's been found that women and minority medical students do have higher stress levels than non-minorities and men. What's interesting is that our emotional health is at its very highest at our baseline or when we're accepted to medical school, and it reaches its lowest point at the end of our first year of medical school, after which point our emotional health begins to improve, but it never again gets to the level that we started at. Well, we know that some of the obvious reasons for that are the intense workloads that medical students are faced with, the intense time schedules. Another factor is the dissection lab, which is stressful for many medical students. And then as we enter into patient care, contact with severely ill, suffering, and dying patients definitely takes a toll on our psyche and can even lead to a reduction in our empathy. Of course, financial troubles can also cause distress, especially with the increasing cost of medical school tuition. However, one of the other factors that's involved in medical student distress tends to be one of the reasons that we get into medical school in the first place, which are our sort of personality traits that lead us to the drive and the ambition that makes us want to become a physician. Most medical students and physicians tend to be perfectionists. We are very hard on ourselves, and we have a great degree of anxiety about making mistakes or experiencing bad outcomes. And when we do have something negative happen, we don't pass a test or we have a bad outcome with a patient, we find it very hard to forgive ourselves. And these are factors that can really lead to high levels of anxiety and depression. Of course, there's also the culture of medical training. Here, Dr. House tells the medical students on rounds that he's going to write them a prescription called Suck It Up. And that's something that we hear in medical school and residency training, which is not to experience any negative emotions, or at least not to verbalize them, like feeling tired, feeling sick, feeling sad. These are things that we're supposed to learn how to just suck up. But unfortunately, coping with our emotions in that way, just by tamping it down and not thinking about it or talking about it, is actually quite negative, and over time it can lead to damage to our psyche. And unfortunately, because many of us are trained in this way, and because we have these personality traits, and because of the intensity of what is required to become a physician, we usually don't address healthily the way that we feel about these issues. And so here you'll see that physicians overwhelmingly in practice are unhappy. Here you see a ranking of which physicians are the happiest, and the happiest doctors are dermatologists, but even they are not extremely happy. They're only 39% happy at work and 66% happy outside of work. And as you see, the numbers just go down from there, with internal medicine doctors being the most unhappy physicians, 24% happy at work and only 53% happy at home. For women physicians, that rate of burnout or unhappiness tends to be even higher. And here you see the red line are women physicians and the blue line are men physicians. And you see that some of the highest rates of burnout include women in more male-dominated fields like urology and orthopedics. Generally, the rates of physician burnout are higher for women, and that has just continued over time. When you ask practicing physicians what their causes of burnout are, the top ranked problems are bureaucratic tasks and spending too many hours at work, and also sometimes developing a feeling that you're not really making a difference and that you're just a cog in the wheel. The reality for many physicians is that they're experiencing depression. We are losing about 400 doctors per year to suicide, and up to a half of all doctors are reporting actively planning to leave clinical practice. The good news is that studies show that by taking care of ourselves better, we can actually reduce our levels of stress. And hopefully, if we learn these techniques now when we're in medical school and our residency years, that will follow us throughout our practice and career. And hopefully, future physicians will have lower rates of burnout than practicing doctors today. And some of the important factors involved in self-care are nutrition, physical activity, having good relationships with others, focusing on spiritual growth, stress management, and taking responsibility for your health. And we'll talk about some of the most important ways to do these things. Of course, self-care sounds obvious, but many physicians are chronically sleep deprived. Of course, in our training, we know that that happens, but even into practicing careers, many physicians don't get enough sleep. So it's really important that we make every effort to get as much rest as we need. We need to make an effort to exercise regularly. We need to eat properly, and we must not neglect our own medical care. And that's very easy to do as a physician because usually you have access to treatments that you can prescribe for yourself or you can reach out to a colleague. But studies show that when we get what they call VIP treatment, it actually turns out not to be VIP after all. And sometimes we actually get inferior care when we reach out for medical treatment in that manner as compared to going through a traditional route of actually seeing your own physician. I want to talk mostly about the emotional demands that you're going to face from now till the rest of your career. When I talk about physician burnout, I usually spend a lot of time discussing the administrative challenges and techniques to overcome them. But this talk is geared towards medical students, so as of now, you really don't have to worry so much about those aspects. Eventually you will, but for now, let's just focus on ways that we can improve our own emotional well-being. As a physician, we're going to be constantly subjected to patient need, and it always seems like there's more need than there is us to go around. So we need to learn to recognize that and to cope with our emotions surrounding a lot of the stressful experiences that we're going to be subjected to. You know, emotions are contagious. So when you're around somebody who's depressed, somebody who's anxious, somebody who's very ill and worried, a lot of times you'll feel some of those emotions, and that's okay, that's normal, but we need to learn how to process those emotions and how to be able to move forward without letting them weigh us down. This can be a particular problem when you're working on the front line and dealing with patient care, and especially in times of extra stress like right now during the COVID-19 pandemic. We know that physicians that are on the front line are especially stressed by the intensity and the degree of patient death and disability that they face, sometimes a sense of futility when they're losing many patients, making difficult decisions or facing ethical dilemmas like if the hospital beds are filling up and you're not sure if you have room to admit a patient. And then of course just exhaustion, concerns about your own safety or that of your family, and as I mentioned, the emotional contagion of dealing with a high degree of patient angst. Stress and distress tend to become more of a problem when they start to lead to depression. And some of the risk factors for physician depression include having to deal with patient death, 24-hour responsibility and lack of sleep, self-criticism or the sense that you've made a mistake, and not having good relationships with your coworkers and patients. So it's important to be aware of those risk factors, and especially when it comes to dealing with difficult emotions, we need to learn how to acknowledge those emotions and practice cognitive reframing, which we're going to talk about in more detail. We also need to practice self-compassion and speak kindly to ourselves the same way that we would speak to our peers or to our family members. Sometimes we're harder on ourselves than we are on anyone else, so we need to remember that we're only human and that we do make a mistake at sometimes and that we're not perfect and we never can be. We should have a low threshold for professional support. In other words, if the emotions are getting very powerful or you're feeling overwhelmed, then don't wait to seek out professional counseling or a physician coach so that you can get some guidance in helping yourself through this. It's really critical not to isolate yourself from family and friends, and that can be really difficult, especially right now with COVID-19, where we can't spend as much time together as we'd like to. But it's really important to let people into our lives so that we can talk and share with them what we're going through. I want to talk about cognitive reframing because it's such a powerful and important tool that we can all use as physicians, but also that we can teach our patients. We all have negative thoughts. They happen all the time, and they're often not something that we're aware of or we're in control of. But when you have negative thoughts and they are occurring over and over again or becoming intrusive, then they can start to take a toll on your emotions. So the best way to deal with negative thoughts is, first of all, to simply recognize the negative thought. So when you're having that nagging feeling that things are bad or that you're a failure or that you did something wrong, then you need to stop and just simply acknowledge that thought. Then the next thing you want to do is to try to consider what may have triggered that emotion. So for example, in the case where you're thinking about a patient, you're feeling very insecure that you did the wrong thing or you made a mistake, you want to ask yourself why you're feeling that way. And so let's say you did have a patient death. You want to identify what triggered the emotion. So you think, I'm feeling very upset at myself, I made a mistake, and it's because a patient died. The next step then is to challenge your thought. And you want to do this by asking yourself if the thought is logical, if there's any proof or evidence that you're thinking that your thought process is accurate. So for example, many times we think that maybe we made a mistake that resulted in a patient death, but if we really think it through, perhaps that patient was already critically ill and there wasn't necessarily anything we could have done differently. So you want to stop and challenge your thought and ask yourself if it's accurate, or are there other explanations? And then after you've done that, you want to practice reframing the thought in a more positive way. So in an example of a patient death, you can say to yourself, it's really sad that the patient died. I feel badly about it. However, I did the best that I could. I offered everything that I could. I will learn from this experience, and give yourself a positive message. And you can repeat that technique as often as you need to. And it's not always easy, and it's something that requires practice because the negative thoughts are usually automatic. So to override an automatic process or thought requires intention and it requires practice. But the more you do that, the better you get at it. And so you want to make an effort every time you're having those negative thoughts to practice cognitive reframing. Another thing that can help with dealing with negative emotions is the act of journaling or just writing down your feelings, and you can do the cognitive reframing process in your journal. Peer group processing, which is really just the act of talking with your friends and your peers and colleagues about your experiences, and often we find that we're all in this together, we're all dealing with the same problems, and we're not alone, and that's very powerful and helpful. And then of course finally seeing a psychologist or professional therapist, because they can really help us to practice cognitive reframing better or learn new tools and techniques to deal with our emotions. Of course, if you're in severe distress, please reach out for help right away. There's a free physician support line that's available to U.S. physicians and medical students. These are psychiatrists that are volunteering their time, and this is an 888 toll-free support line number. There are some techniques that can be helpful in coping with stress that are really quite simple, but something that we often just don't take the time to do. And one thing that you see over and over again in the literature that improves stress is something called mindfulness. And a perfect example of this is in this picture where a man is walking the dog, and the man is thinking about all the things in his life that he has to worry about, and the dog is just looking at the trees and the sun. So it sounds kind of touchy-feely when people talk about mindfulness, but it's actually a really powerful tool, because what you're doing is you're redirecting your thoughts. Instead of letting them just ramble through all these worries and concerns, you're actually forcing your thoughts to just what is happening right in front of you. And that could be something that you see or something that you feel or just being aware of your body. And studies show that when you practice mindfulness, even 10 minutes twice a day, you can actually develop rewiring of your brain, and this has been shown in functional MRI scans that improves your well-being. And there are some easy ways to practice mindfulness. You can try just enjoying simple pleasures like a walk outside, or breathing calmly in and out. You can even practice mindfulness just for 10 or 20 seconds while you're sitting at your desk. Really, it does not require a full elaborate meditation type of a process, although that's another option that you could do too. There are a lot of apps out there that can really help you, and many of those are free for healthcare providers. Another aspect of mindfulness is something called gratitude training, which is just the idea of taking a few minutes to think about the things that you're grateful for and appreciative of, and then also imagining what your life would be without those things. So especially when you're stuck kind of in a funk or thinking about all the negative things that are happening to you, taking a few minutes to think about the things that are good in your life is really powerful and has been shown in studies to improve wellness. When it comes to taking care of yourself, there's the basic things that we talked about, like eating right and exercising and getting enough sleep. But then there's also taking care of your own emotional needs, like recreation, like making sure that you have time for yourself. It can be hard to find time to do these things. One of the pieces of advice that I give to young physicians is that when you get your first job, of course after residency, because you don't have a lot of control in those years, but when you're negotiating your first real employment contract, try to make sure that you schedule or get a half a day or a full day off from work every week so that you can take care of your own needs, because otherwise you just won't have the time to see your own doctor or dentist or go to the bank or go to the post office or all those little things that you need to get done at some point. It's also really important to schedule the important non-work activities that you need to do and make them non-negotiable so that you always get time for exercise or for dates or just time for yourself. And the only way that you'll be able to do this is by setting boundaries. It's very hard in medical school and residency to set boundaries because your time really is limited, but especially when you're starting your first job, you want to make sure that you always think about your work-life balance. Make sure that you're not taking work home, or if you have to, that you schedule a buffer time to relax a little bit. Make sure that you don't get pressured into going into work sick or when you're excessively stressed. Take a personal day. And make sure that you are not always trying to be a people pleaser, which is tough because as physicians we tend to be people pleasers. We usually say yes to everything because we don't want to let other people down. So we need to learn to say no and realize that no is a complete sentence. You don't need to elaborate on why you're choosing not to do something. You can simply say no. In fact, sometimes the more you say to try to explain why you can't participate in something, the more the person asking you may think that if they keep nagging you, you'll eventually change your mind. So sometimes just saying no is the right way to go. And one thing that can be helpful if you're the kind of person that finds it hard to say no is to not necessarily answer right away when someone asks you to do something. Like let's say they're asking you to sit on a committee. The first thing you'll do is you can tell them that you need to think about it, and then take a moment to consider what value you would get from that activity. And if you contemplate that and you think that it will bring value to your life, then by all means say yes. But if you, as you think it through, you really can't see where it would necessarily help you or add value, then that means that you need to say no. And you should practice in your mind saying no, but feeling calm, feeling comfortable, and not feeling that the person that you're saying no to is going to get upset or be let down. So you kind of want to go through an exercise in your mind where you feel in control as you say no, and that will help when you actually go ahead and let the person know that you're not going to be able to do what they've asked you to. And this is especially important for women physicians because we tend to have a lot of roles that we take on. And there's something called role strain, in which the more roles you have, for example, I've listed some here. So some of your roles are you're a physician or a medical student. You're an employee or a student of a university. You're also a co-worker or a team member. You're a friend. You may be a parent. You're a child. You may be a spouse or a partner, and so on. And so all of these roles have demands, and sometimes you have to take off one hat to put on the other hat. And this can come into conflict if these roles are competing with each other. So for example, in this illustration, someone that's an employee, but also a student and also a child may be faced with a conflict when their time is being pressured between choosing to be the worker role, where your boss may ask you to come in for an emergency, in conflict with your role as a student, in which case you have an exam coming up, and then maybe if you have a parent that needs you too. So all three of those roles may come into conflict, and it's especially a problem for many women where they're trying to balance their role as a mother and a spouse, and along with being a physician. And we know that it's a particular issue because women tend to perform more childcare and household duties than men. And the main reason is because most men physicians have a wife or spouse that works at home or just works part-time outside the home, whereas 95% of women physicians have a spouse that works full-time. So since we often don't have someone at home taking care of the children or taking care of the household, when we get home and our partner gets home from work, there are so many tasks that need to be done still, and often we end up taking on those responsibilities as well. And that can get overwhelming, or we may even feel resentful towards our partner if we feel that we're doing the bulk of the work. It's especially important if you have children to acknowledge that women have a decrease in their mental health when they have young children. Fortunately, our mental health improves when child rearing is complete, but that's a number of years in which we're facing a significant additional stress from having kids. So we need to recognize that having this role conflict can create a lot of stress and a lot of guilt. Sometimes women physicians feel guilty when they're at work because the kids are home, and then when they're with the kids, they feel guilty about not being at work. So it's almost an unwinnable situation. So the only way to manage that is to acknowledge that it's real and to practice reframing and recognize that you are just doing the best that you can. You can also make sure that you're communicating really well with your spouse or partner, and be sure that you're defining your roles and responsibilities, ideally before children come into the picture. And also make sure that you accept help from your partner. Many women physicians have expressed that they find that hard to do. A lot of times they have the attitude of, it's easier just to do it myself. But or the other issue that sometimes come up is that the partner isn't doing things the way they would do it. They're not putting on the diaper correctly, or they're not, feeding the kids the type of food they would cook. But we need to realize that sometimes we have to allow our partners to do things even if they're not doing it necessarily the way we think is best. So accept that help, and then also don't be afraid to get outside help. Physicians often have additional resources like financial income that we can use to pay for assistance, like a housekeeper or a nanny or daycare. And we can't feel guilty about doing that because it's just impossible to do it all. If you can seek a job that offers flexibility, that can be really helpful, but that's not always easy to find. I also just want to say a word about divorce, because the fact is that women physicians do have an increased risk of divorce. And what's interesting is that the risk increases with the number of hours that we work. It's kind of weird, but for men physicians, it's the opposite. The more hours they work, the less their risk of divorce. So I just always like to let women know that it's a really good idea to get a prenuptial agreement, because if you do end up getting divorced, and hopefully you won't, then having that prenup just makes the whole process so much easier and less stressful. Going through divorce is very stressful, and especially when lawyers start getting involved. For the final section of this discussion, I'd like to talk with ways to deal with difficult people in your lives. As medical students, you've already had some experience dealing with patients and perhaps difficult coworkers or people who are under a great deal of emotional stress. Maybe they're navigating the healthcare system, maybe they're sick, maybe they're afraid, and so they have a strong emotional reaction. And as you enter into practice, you'll find that you may have to deal with 15, 20, or even more different people and personalities per day, and often you're called upon to de-escalate stressful situations, and we don't always get great training on how to do this. So I'd like to give you some tips from psychology on ways that can really help you to communicate really well with patients and with other people, and to get the best out of difficult situations. One technique that's so important is called emotional mirroring and validation. And this is something that I use every day when I'm dealing with patients, especially with people that have a lot of medical concerns or problems, people that are very anxious about their health, or people that are just emotionally charged at the moment. So the way to do this is really involves a lot of listening and repeating back. So the way you always do that is by starting by asking an open-ended question, which of course, you know, as medical students, that's the hallmark of performing a history, is to try to ask an open-ended question. Then you want to not interrupt the patient, which unfortunately physicians are notorious at doing. Studies show that we interrupt patients about 23 seconds into their when they're talking, and usually if we let them keep talking, they would only go for a few more seconds. So we want to listen carefully to everything that they have to say, which usually isn't as long as we fear it will be. And then you reflect back or mirror what the patient said in your own words, asking for clarification or saying to the patient, is that right? And then finally, you want to validate the patient's emotion. So if you have a person that's, let's say, feeling very anxious, you can just simply ask them, how are you feeling right now? And then listen carefully to what they say. And they say, well, I'm really stressed out about things that are going on in my life. And then you reflect back to them. So it sounds like you're going through a lot. Is that right? And then if they say yes, then you validate them. You say, wow, well, it sounds like that would be really a tough situation. And really, you can do this for pretty much any emotion. So again, you have the patient with a laundry list of health complaints that they need to get through their long list. So you've already addressed their chest pain, let's say, the most important thing. You've set up a plan, and then all of a sudden, while your hand is on the door, the patient says, oh, also, doctor, I've been having this pain in my back. So now you're like, oh no, I don't have time to deal with that. I just spent all this time talking about their chest pain. But the problem is if you don't deal with it, or at least address it and validate and let the patient feel that they've been heard, then the patient is going to go away unsatisfied. Even though you've been a great doctor and you've actually done what's important, the patient won't necessarily recognize that. So in this example, the patient says, oh, doctor, also, I forgot to tell you I'm having back pain. You want to say to the patient, oh, you say you're having back pain, and they say, yes, it's, here on this part of my body, and it goes down my leg. So then you reflect back and you say, so you're having back pain and it goes down your leg, is that right? And then they say yes, and then you validate the emotion. You say, well, it sounds like that's really bothering you. However, you don't have to then make a treatment plan for the back pain. This is where we sometimes get into trouble as physicians, because sometimes we want to then try to address or fix everything. So in this example, you've spent 30 minutes with the patient on their chest pain, you have a plan, now they've thrown the back pain at you. So you can validate and say, well, it sounds like that's really bothering you. Unfortunately, we don't have time to get into a lot of details on that, but because we talked a lot about your other problem, which is really the most important, but I want to hear more about it, so I'd like to schedule a follow-up visit so we can go over it. So again, you're not necessarily solving the problem. However, now the patient feels heard, and they're going to leave the office visit feeling at least that they were heard, and they can make another appointment to discuss their back pain. So just practicing this emotional mirroring and validation can really help with so many different issues that you'll face in treating patients. It's also critical when you're dealing with a highly charged or emotional situation. We need to remember that when people are really upset or feeling very emotional, a lot of times they are not able to engage in logical thinking. And the problem is that they're stuck in something that we call amygdala hijack, which means that their brain is kind of locked into a more primitive way of thinking. So the way to move them through that is to practice this technique. And so you first start by identifying the emotional state. So you walk in the exam room and a patient looks very angry. They've got their arms crossed, they're tapping their foot, and so immediately you recognize that. And so you're not going to be able to move forward with this patient with their treatment until they get past that strong emotion. So you start by doing the emotional mirroring, which is just simply to state how you think the person is feeling. So you might say, oh, Mr. Jones, you seem really angry. Is that right? So you ask if you're correct. Then they're going to answer you, yes, I'm angry. I've been waiting for 20 minutes. Or maybe they'll say, no, I'm not angry. I'm just really worried. But if they're angry, let's say, then you validate the emotion. You would say, oh, you've been waiting for 20 minutes? Oh, I understand why that would be really frustrating. I could see why you would feel angry about that. Now remember, you're not telling them that they're right to be angry. I mean, after all, maybe you're running late because you were just telling someone else that they have cancer. You're just simply validating that person's emotion so that you can help them move on. So you validate the emotion. If they say, no, I'm not angry, I'm just really worried, then you would again restate the emotion, the correct one. Oh, I see, you're really worried. And then, oh, I can understand why they say, yes, I'm worried because I'm sitting here waiting for my test results. And you say, oh, I see, oh, I would be really worried too. You're sitting here just, wondering about your results. So then you will watch the patient to see if they're responding to your de-escalation. And usually you can tell this because the patient will usually give an audible exhale or a sigh, and they often will then invite feedback or desire to move forward and say, well, it's okay, let's just talk about my results. I'm just, stressed today. But if they're not ready, they still seem really aggravated or angry, then just keep repeating, trying to identify the emotional state and just validating the emotions. But usually it's surprisingly fast how quickly this technique will de-escalate a patient's situation. Many times a patient just wants to feel heard and validated, and it's amazing how well this does work. I also want to take a minute because many women physicians do experience sexist remarks, and of course racism unfortunately is still something that many experience in the healthcare system. But it's really important that we learn how to confront uncomfortable remarks or sexist or racist remarks that are made towards us, because by ignoring them, then we actually are going to feel worse later on, and we're not going to take the opportunity to empower ourselves and to let the person know that that kind of behavior is not okay. And it's really interesting because studies have shown that when most people are confronted, especially when men are confronted with sexist remarks, they actually respond pretty well to it, and they mostly feel positively about getting that messaging. It's not something that you would necessarily expect. However, that's what studies have shown. So what you want to do, first of all, is not ignore the comment, which you usually want to do because it's usually upsetting, embarrassing. The first instinct that many women have when they're faced with a sexist remark is to laugh because we're uncomfortable, not because it's funny. But if we laugh, then we're giving the message that this behavior is okay or cute, or that we're not bothered by it. So what you want to do is when you hear something that triggers you, that it's inappropriate, you want to acknowledge the comment, but in a very calm manner. So I had a friend who a patient said to her, if I wasn't married, you and I would be hooking up. And she really didn't know what to do, but what she could have said at that moment is, you just said that if you weren't married, you and I would be hooking up. Is that right? And then when you do that, you allow the person to hear back in their own ears what they said. And a lot of times that will make them realize that it was inappropriate. And then you respond in a controlled way and very calm. You just correct them and say, it's not appropriate to speak to me that way. I'm your physician. And then you continue on with what you were doing in your conversation with them as if what they said had no emotional impact on you. So you take the power away. And what's really, really important is that you stay calm and controlled. And that's tough because, you are going to feel kind of anxious or stressed probably when you're doing this, and it will be uncomfortable. So we want to practice this on our own, not necessarily exactly what you would say, but more the way that you would feel. Just imagine that you're telling the person that's not appropriate in a calm way, and that you're feeling powerful and in control as you face that person. And again, the more we practice and the more we call this out, the better it is for ourselves and for our fellow women. Thank you so much for joining me for this discussion. If you'd like more information, please feel free to check out my books that I wrote, one of which was co-written with an amazing psychologist. They're both available on Amazon. You can also visit my website, RebeccaBernard.com, follow me on social media, or drop me an email. Thank you again.